Hello and good afternoon, good morning. This is Bill Graff with the Senior Estate Concierge. And today we have a special guest speaker, Mohamed Hussein, with All About Healthcare, All About Home Care, excuse me. And we're going to talk about the future of senior care. So, good morning, Mohamed. How are you?
I'm doing well, Bill. How are you?
Very good. Great to have you here. It's nice to
Thank
see
you.
you.
It's good to
Yes.
be here.
I'm going to do a short intro about the Senior Estate Concierge and what we do, and then we'll go through and we'll have a few questions and let you talk a little bit about the future of healthcare. Okay?
Awesome.
Great. We are the Senior Estate Concierge. We are a senior resource and solutions organization made up of various senior healthcare and senior services. We cover everything from healthcare, as we're talking today, to financial help, to moving help, to legal help, whatever seniors and their family would need help with to get through the life challenges, get from one point to the next. Basically, we are here to bridge the gaps in the senior service industry. So, with that, we like to interview our senior service providers and each month. And so today, again, we have Mohamed Hussein. He's a MBA Director of Operations and Business Development for the organization All About Home Care. So I'm going to turn it over to Mohamed, let you do a short introduction to All About Home Care, and then we'll go into some questions and answers. Okay?
Absolutely. So just to tell you a little bit about us, All About Home Care is a skilled home health organization that's been servicing the greater Houston area since about 2003. So I think that makes this year 18 for us. We're Houston, owned and operated. We consider ourselves part of the community, and are very proud to service Houston and Harris County and Fort Bend County, and the greater Houston area. We're also very fortunate to be led, by a very strong clinical team. Our administrator is Dr. Hussein, who's a PhD physical therapist. Our director and clinical manager is Tahani, and she's a fantastic nurse who's been in leadership for nearly 10 years. We're very fortunate to have a history of zero deficiency surveys. So any basically provider that's licensed in the state of Texas gets surveyed every 3 years, and we're very fortunate to have that high operational standard. We're also we service primarily a geriatric population, and thus are part of the Medicare home health program, and we are a 4.5 star CMS rated company. So we're proud of the work that we do. We consider ourselves experts in home health. We've been doing it for a long time and have a lot of the clinical and operational expertise, to do a good job. So, we love our work, and we're really excited for, what is to come.
Right. Very good, Mohammed. Great introduction, and I know what I know about you, your organization, your company. It is a top-notch, highly qualified, excellent service company.
Thank you.
So today, let's talk a little bit about the future of healthcare. We've had a lot of changes in 2020 with COVID, and I think we're all kind of starting to see the light at the end of the tunnel, but we all know that things are going to change in the future in some aspects. So, if we could, let's talk a little bit about what do you think the most common challenges or issues or needs are for your specialty going forward?
Um, so, that there's a lot that can be said, but I can tell you one of the regular challenges is staffing shortages. We pre-pandemic, there was a nursing shortage. It's only been exacerbated by the pandemic. As nurses in particular were pulled into more acute settings, to handle those, basically the surge in COVID-19 numbers. As an industry, we felt the nursing shortage there exacerbated. So addressing the clinical shortage is definitely one of the challenges, and also having the payers adjust to the situation is also one of the challenges. Different payers have you on different models, for reimbursements and whatnot. So navigating that web of payer mix is definitely another challenge to us and the industry at large.
Yeah, I could see I've heard that from other companies that the staffing is just a real one of the major challenges, getting good help and
Yeah.
yeah. So that's a tough one. Where do you typically find your staff, and how are you overcoming some of those challenges?
So we have a strong network of clinicians. So just like a lot of people get jobs through knowing a colleague or whatnot, word of mouth. But we're also very active online as well, through job placement boards. We've worked with recruiters in the past, but currently, we're relying on boards and that sort of thing primarily.
Okay. And with the payers, working with those, I guess, do you have a support staff that helps with those situations?
Yeah. So on the payer side of things, the payers really dictate a lot of the rules in terms of being able to access that patient, if you look at it from a market perspective, and also for where that patient is directed to go for their services. So there's been a big push for managed care, and folks getting on managed care types of plans, which have specific networks. So if you're outside of that network, you might not be able to service that patient, or you might not be able to service them in a streamlined manner. You might be able to service them, but you would need one-time agreements with the payer, and there might be some additional administrative steps with getting that. So you have to those kind of situations are definitely a little more tedious for an organization to manage or to navigate.
So one of the challenges, if I hear you right, is being able to stay in those networks, right, and being, I guess, going through the qualification process to qualify
Yeah.
for those networks.
Well, the
Right?
qualification is the easy part.
Okay.
They close their networks for I know a couple of insurance companies that have been closed for nearly 10 years. Every time we've tried to engage them, they're just closed. So we're unable to treat those patients under their insurance, because of the fact that those patients need, if they want the service to be covered by their insurance, they have to go to those specific in-network providers. And then also, the enrollment periods where you can, contract or get in network, vary from insurance to insurance, and they're typically, a couple months at a time. So it's, and we've been active on that front, so we're very fortunate to, to always be, trying to engage the insurances. Because we as providers, at the end of the day, we want to service patients who show up. So if a patient presents, or if they're sent from an acute facility or a post-acute facility, we don't want to turn down due to your insurance not covering. So when we get those referrals, we make an active effort to engage the insurance company.
Okay. Very good. Yeah. How has COVID affected the managed healthcare? I mean, really being able to get into a network for both the service providers and the patients.
For us, it didn't really, we weren't approached by any insurances saying, hey, there's a need, join our network, let's get a contract in place. So my initial thought is no on the insurance side.
Okay. Okay. So let's talk a little bit about finding your services. How would you locate the best services for your specialty? So,
Like, how would a patient get our service, or?
well, I think more like how would you locate the services for your side of your business, for
Yeah,
the staffing and all.
yeah,
You talked about some.
yeah. So the vast majority of our field staff are clinicians. So they're all licensed. So they have some type of license, whether it's an LVN or an RN or a PTA or a PT or a CODA. Everybody's licensed. So we do, we as I had mentioned, place postings on recruiter websites. We do some work on LinkedIn as well to network with folks, and then we have an onboarding process that they go through, and basically, once they're onboarded and trained, they get started. We evaluate, and on a regular basis, our field staff performance, and we're in communication with them, on a daily basis.
Yeah.
So our office staff might have, well, pre-COVID. Now everybody, most people are working remote these days, but at any time you'd have 10 to 12 people in the office doing administrative tasks, but the majority of our clinicians are all out in the field. We, communication is incredibly important in home health, and we're in touch with our clinical staff, our field staff, on a daily basis.
Yeah, very good. Yeah, you really do have to stay in touch all the time nowadays in the virtual world that we're more in tune to nowadays, right? Yeah. So on the patient side, or for our audience, and the future of where you see how services will be provided. I mean, obviously, you still have to provide services firsthand and in person, but getting those services, what are the top 3 pieces of advice you'd provide for our audience today going forward? And how do you see things going forward?
Yeah. I would say, to try your best to plan with family, the needs that it's difficult to speculate or anticipate, and these things always catch us by surprise, but as best as possible, to plan with whatever support system is available. So family, I would say is number one. Be on the same page with your primary caretakers at home. If there isn't necessarily that family support structure, then I would say level 2 is engage your primary care to try to anticipate what services may be needed, but also I would say engage your insurance company and really know what your insurance covers and what it doesn't cover, and also the limits of what it will cover, up to what extent, how much you'd be responsible for out of pocket, and that sort of thing. We are more post-acute oriented. So the majority of our patients, have just had an injury or an exacerbation in their condition, or a hospitalization or something of that nature. And so when they come to our service, we're typically getting them from a more acute setting.
Okay.
And it's really our role to stabilize them, put them onto a home, healing and rehabilitation program. And so, a lot of times, home for a lot of people, home is the best place for them to heal.
Yeah.
And home, obviously, you have the physical environment, but you have other family members and caretakers that play a very important role. So I guess those three, I would say to engage these three parties, family, your primary care, your doctor, to anticipate any potential needs and to prevent any exacerbations.
Right.
And then also your insurance company, know what they will cover, what they won't. We try to be a resource for the community. So we're always, we get calls every day of people asking, if they're suitable for our service, if we would recommend another service. So also, just be proactive and engage, home health providers. And I think also another fantastic resource is the senior state concierge. There's so many specialized services for the elderly and geriatric patients. And, I, as an individual, might not have, or us as a company, as an organization, we might not have a specific answer for your specific situation. But a group like the senior estate concierge is definitely more, better positioned to answer that question.
Yeah, well, very good. Thank you. Yeah, I think those are three very good suggestions for planning ahead, right? Because that's very important. And typically, we'll see, at least in my experience and other people I've talked to, that there's you know what's coming at some point, or you have an idea of what's coming. You don't know when it's going to come, but we can plan it pretty far in advance. We're all going to get older, and we need to be prepared.
Sure.
I was talking to somebody today that was referred to your organization, to your company, and she really loved it and has gotten very, very good care from you. So that's excellent.
I'm glad.
Yeah. And thank you for discussing or talking about the senior state concierge, because that's really what we're all about, right? Bridging the gaps and being resources, solutions organization, so that you can find those pieces of the puzzle that you really need, and that's what we're here for as well. So we're glad that you are a member in our organization. That we really are. You're very valuable. I know you've helped a lot of other service providers in those situations. So it's very good. Really glad that you're with us. Yeah.
Absolutely.
Thank you. Appreciate it. What are your with all this said, and the planning part of it, and on your side, when someone's at that point where they have an acute problem or other issue, but I guess from the planning side, how do you see the future? Do you think it's going to change much, or it's still going to be, be prepared basically? Or do you think with COVID, do you see much changing?
So I think COVID has really, highlighted the need for more home-based services. Mm-hmm. And I think that trend is only going to continue and increase. And there are a number of benefits to home-based services. Like I said, for a lot of folks, home is the best place for them to heal. And home is also where they'll have the most, support structure from family and whatnot. So I definitely, I would definitely think that the trend for expanding home-based services is going to increase. My concern or where I would hope that things progress maybe at a faster rate is payers getting the note or the memo that people, that it's better for people to heal at home than it is, or the home may be more conducive to their healing than other facilities. Obviously, there's a tremendous financial benefit of people healing at home. Is to insurance companies is it's a lower cost place for services,
right?
Typically, the healthcare model, the way that we receive healthcare is quite complicated, here in the United States. and there's many layers of, regulatory bodies as well as payers and different types of payers and, primary and secondary. So, my concern is that system may, cause, it may make it difficult for those who need it to navigate that system. So for patients and people to navigate, these really complicated systems, and as I had alluded, previously, they direct who can get services, who can get what kind of services, and who can deliver those services. So getting clarity, would make life easier, I think, for patients as well as providers.
Yeah. When you say they, you're referring to the insurance companies,
Yeah, insurance
basically?
companies. Yeah,
Yeah.
payers,
Payers.
essentially.
Yeah,
Yeah.
right. So where can a consumer, I got a couple questions. What's the best place for a consumer to find that information other than their insurance company or their payers? Is there somebody that can help them navigate through all that maze and get answers?
So, whenever they call us regarding home health questions, we can definitely guide them and assist them regarding anything home health related. If they are seeking any more general information, I think there are a couple of folks in the group as well who may be able to give them more more precise answers about about their specific needs, because plans cover different services in different ways, and so depending on the needs of that specific individual, they might be directed to a plan that better suits their specific needs. But I can tell you, when folks call us, and we check their eligibility, we can tell them pretty quickly, under our service, you would have this specific copay, or you'd be responsible for this coinsurance.
Okay.
But typically, anything. So our service is covered by Medicare.
Okay.
So any patient on a traditional Medicare plan or any Medicare-based plan, where there are Medicare benefits, they would be covered by us in general. The exception is, if it's managed care and it's a network that hasn't extended a contract to us, then they would have to reach out to their insurance company and likely be directed through them.
Right. Right. Okay.
And I would also advise folks, before they get on any service, especially Medicare beneficiaries, Medicare has some great tools for you to compare companies. So there's a home health compare platform, for example, but there's also one for skilled nursing facilities, for hospitals, where they rate and they rank companies. So I would definitely advise folks to, check on the organization before signing up for service.
Okay. So like a Medicare, Medicaid specialist, VA benefit specialist, those types of
those folks will
contacts.
Definitely, they can definitely help identify the right plans.
Right. Okay. Very good. Good advice. I appreciate that. So my other thought is about virtual medical appointments. Are you guys doing more of those now? And then also, sorry, feeding onto that, do you get more of your information back to your care providers on a virtual basis, or is it still? Do you still see it still going face to face more, or is it leaning more towards virtual?
For our service is primarily face to face, and I think it will largely remain that way.
Okay.
Because if you think about a nurse, what a nurse does is at the bedside.
Yeah.
A nurse is there, for to help heal a wound. We get family involved and whatnot. But also to maybe go over meds. So that's something there. We want to make sure we account for the medications that are there. We also have big therapy staff. And if you think about what therapists do, physical and occupational therapists, they're evaluating in person. They're evaluating somebody's ability to stand on their own,
Right.
or they're performing actual functional tests on patients, and our follow-up therapists actually perform the exercises that are meant to strengthen or help people regain their balance and whatnot. So I don't discount the role of remote or virtual visits in home health. I think that they will play an important role in the future, but it's something that to my knowledge is not covered by payers at this point. But I'm certainly open to learning more about it. But it's something, it's yet to be fully developed.
Right.
There's some guidance about using virtual visits to conduct parts of our work, but the full role, I think, has yet to be fully developed.
Right. Yeah, there's still probably a lot more work to do there.
Yeah.
And hey, let's hope that maybe COVID goes away more than we want, and we won't have to go down that road too far.
Right? Yes, sir.
But I think a lot of that is we're already going down that road to a certain extent. So yeah. Okay. Well, I don't really have any other questions at this point, but I really appreciate you being on the show. Do you have any other comments or anything else you'd like to share? Please
absolutely. So just to reiterate, we're a Houston-based company. We've serviced Houston for 18 years, and Houston has seen extraordinary growth the last few years, and it keeps expanding in all directions. And as Houston expands, so do we. We intend to continue growing with the city. So I think there's a little bit of contact information that is at the bottom of the screen there. You're welcome to email us or give us a call anytime, ask for me directly, and I'm happy to answer any questions that you may have. We definitely want to be a resource to the community, and we've built quite a bit of knowledge on the skilled side of home health. So if there's ever a need, we are more than happy to step in and really serve our community.
Very good. And how far around the Houston area, general area, are you going? Because it's getting bigger and bigger, right?
Yeah, absolutely. So our general coverage area is everything within the Grand Parkway.
Okay.
So within 99, when I first learned that they're actually completing the 99 on the east side and that it'll be a full-fledged loop, I found it a little hard to believe. I think it will officially be the world's largest loop, I think. Yeah. But I'm not surprised if they start building something else, a few miles out from that. So, as Houston expands, we will, expand with it. And we're based right in the center of the city, is where our office is. But our staff are all mobile. They're all in the field in different parts of the city. And we intend, to continue servicing Houston. So if you're in the greater Houston area, we can more than likely service that address, and we hope to continue growing.
Very good. That's awesome. Well, again, Mohamed, thank you so much for being here today, and we really do appreciate all the information. Folks, if there's any questions for Mohamed, please feel free to reach out to him. You can see his contact information there on the bottom. He's very knowledgeable, as you can see, and they are a great company, caring, and will provide the best care for you and your family. And with that said, thank you again, Mohamed, for today. Thank you for being part of our Senior Estate Concierge organization. You're very much a valued provider that's in the organization, so we appreciate you being there.
Our pleasure. Okay. Thank you, Bill.
All right. Well, look forward to seeing you soon.
Likewise.
All right. Have a great day.
All right. You too.